Well, hello, and welcome to my case study on pediatric hematology. So, this child is an 18-month-old that's brought to the clinic for a rash, and it's in quotes, so that's what the parents say. They're bringing the child in for a rash the past 2 days and a bloody nose that lasted for 15 minutes. So, that's kind of concerning them. The heart rate is 100, the respiratory rate is 26, the temperature is 98.4. Does anything in that concern you? No, those are normal vital signs. Good. The 18-month-old is in the clinic office, playing, alert, no distress, not breathing heavy. So does that concern you? No, that makes me feel comfortable. Remember the word toxic. If you have a child that's in the office that looks toxic, that looks very, very sick. So this child is not toxic looking. The child's abdomen is soft, but the skin has petechiae, which are tiny little pinpoint hemorrhages all over the face and the trunk. And when you press on them, they don't go away. That means that they're non-blanchable. So is anything in there concern you? Yes. So we're going to do some labs. So the RN notifies the provider, and the provider orders a complete blood count. And the results come back. The white blood cells are 6,000. That's normal. The red blood cells are 4, which is normal. The hemoglobin is 11.2, which is normal. But the platelets are only 10,000, which are low. Normal is between 150 and 400,000. So that means something significant. This is low. Remember what the different blood cells are responsible for. So this is a huge pens up. So really just kind of make it very simple for yourself. The white blood cells help fight infection. The red blood cells and hemoglobin help you with your oxygenation. Platelets help you with bleeding. So what's going on with this? Well, it's idiopathic thrombocytopenia purpura, or ITP. So how do we manage this? Well, we're going to tell the parents that this is usually an immune response following a viral illness. It produces antiplatelet antibodies. So it's an autoimmune type disorder where the virus usually comes a few weeks before, and then the body forms these antibodies which start killing the platelets. Then the babies will develop, or children will develop, signs of this bleeding. They'll develop petechiae, these tiny pinpoint little hemorrhages, or they will get bigger bruise-like hemorrhages called purpura, or they'll just see bruising. So most children, the good thing is most children recover in just a few months. But we need to instruct parents to be very careful with their children and avoiding contact sports. They need to avoid injury because if they have an injury, they could bleed to their internal organs. So it is a potential complication. Corticosteroids may be administered, or if the platelets get very low, the intravenous immunoglobulin, IVIG, might be administered, right? So instead of waiting for the baby's own antibodies to do the work because they're attacking the platelets, we would give antibodies that would work. So this is a picture of a baby that has ITP and what that looks like. So these tiny little pinpoint hemorrhages are petechiae, and these larger ones are the purpura. So what is the nurse going to focus on with this child? Well, definitely the nursing assessment is going to be focused on this increased bleeding. We know that the platelet count is low. We know that the baby has petechiae and purpura. We have checked the stool for a hemoccult, and there is no blood in the stool, which is good, which is a good sign that there's no internal bleeding. Sometimes a viral illness, they think, may trigger this ITP, or some instances they believe that a possible MMR vaccine may have tricked the body into this type of a response. We want to ask if the baby had any recent illnesses, and the child did. The child did have a recent illness 2 weeks ago. Sometimes they think certain medications can cause this, but the child has not been on any medications recently. Usually the rest of the exam is normal, and that's the case for this child. The rest of the exam was perfectly normal. He was happy, playing, um, alert, no other signs of problems. A bone marrow aspiration was done just to rule out leukemia, because sometimes leukemia can present in the same manner. So this idiopathic thrombocytopenia purpura, or ITP, is managed by observation, watching it carefully to make sure that the platelet count is not dropping too low, make sure that the baby is not having signs of internal bleeding, and so forth. We will be checking the platelets frequently to make sure they're not dropping too low, or our management plan may need to change. We will instruct the parents to avoid certain medications which could increase bleeding. Do you remember what those are? Of course you do. Aspirin and NSAIDs, and even antihistamine sometimes can lead to further anemia. We are going to instruct the parents if they do need to administer a medication for a pain or a fever, definitely to notify the provider, but also they can use acetaminophen for that. Big pens up, we need to prevent trauma. Sometimes these little toddlers, because they have such big heads anyway, because they're toddlers, they're top heavy, they fall a lot. Sometimes we'll have them wear a helmet. And we definitely want to instruct parents on when to call 911. If there's any sign of bleeding, they need to notify their provider. Thanks.